Thank you very much. And distinguished guests, Chief Minister of Manipur and everybody else, I'm really delighted to be speaking at the launch of this 10-bed ICU project. This is an extraordinary project and I'm really delighted that it has come there to your state. The 10-bed ICU project was conceived as a response to the challenges we had in the pandemic. During the pandemic, especially during COVID wave 2, the rapid spread of the whole virus, the pandemic, and the fact that people were having difficulties in the respiratory system showed that we need to have much better healthcare infrastructure, especially in more remote parts of the country. And the lack of ventilators, the lack of oxygen, all these contributed to a large number of fatalities. And the 10-bed ICU project was conceived as part of that. And today it's amazing that because of this idea, it has now reached 8 states and 200 hospitals. And it is not only a issue of having the right infrastructure like ventilators and oxygen cylinders, it's also the ability to use software to provide the best capabilities in every ICU unit, to software to manage the patients, to bring in new patients, take out patients who are feeling better, and also the TeleICU hub, which is required so that even people in a remote village can get access to the best medical facilities using the TeleICU hub. So this is a very, very important thing, and I'm really delighted this is happening. This is also part of a larger theme in India, what we call as Digital India, where the idea being in the rest of the world, technology is used for entertainment or consumer consumption. In India, we have been the leaders in using technology for social good. And over the last several years, we have built many population scale infrastructure, be it Aadhaar for 1.3 billion people, be it the UPI payment platform, which last month did 5.8 billion transactions, and last year did $1 trillion of the transactions, be it the account aggregator, which allows people to use their own data to get better healthcare and education, be it the Diksha platform, which is used across the country. So what we are seeing in India is that we are using technology for social good. We are using technology to improve the lives of people. In the first round of technology, it was applied to financial transactions, benefits, and so on. Now, in the second decade of this technology, it's being applied to areas like health and education. We are seeing the development of the health stack by NHA, which will make health records interoperable and so on. So India is a world leader today in applying technology for social good. And the 10-bed ICU project is a great example of how we are able to leverage the best hardware in terms of ventilators and beds and oxygen, but also software to do remote diagnostics, software to optimize the bed usage, software to provide teleconsultation, and all these things are now being done in the 10-bed ICU. And it'll also get the best support from the hub, where medical colleges and medical professionals at the hub will provide remote services to people all over the state. So once again, as I said, it's already reached 8 states, but the idea should be to have a 10-bed ICU in every district should have at least one 10-bed ICU. And the modular nature of design of this means you can add more such units very quickly because everything is packaged in a way that it can be replicated very fast. So once again, I congratulate all of you and all the best at this inauguration of the 10-bed ICU project, and may there be many more in your state. Thank you and all the best.